Hi guys. So I recently came across Alex Earl's post on TikTok about acne and being on Accutane. I liked it because she normalizes acne. Acne is normal and that is okay to be on Accutane and see how much it can improve your well-being. So as a dermatologist, I wanted to use this opportunity to talk about Accutane and acne and to weigh the risks and the benefits or the pros and cons of Accutane for your acne. So what is Accutane? Accutane is isotretinoin. It actually doesn't even go by the brand Accutane. It has several other different brands now, but still, just like Kleenex, it is primarily known as Accutane. It is a synthetic derivative of vitamin A. So it is a retinoid that you take orally by mouth. But don't let that fool you. You cannot take a bunch of vitamin A in any sort of form and have clear skin or clear acne. So just keep that in mind. So how does Accutane or isotretinoin work? It works by programmed cell death, called apoptosis, of the sebocytes. Sebocytes are the cells in your skin that produce sebum, or oil, and keep your skin oily. So obviously you want your skin to be a little oily, but not too oily to cause acne. And so that is how it works. Isotretinoin is FDA approved in the United States for nodular cystic acne, severe acne that's recalcitrant to other medications, as well as scarring acne. What are the pros and benefits of using Accutane for your acne? Well, the pros is that it works very well. It is very effective in clearing even bad scarring acne. Another benefit is that you don't need to take it forever. The typical course is somewhere between 4 and 6 months, and most people, 75%, never need to take another course. So it's a one-time 6-month treatment, and that's enough to clear your acne. So again, isotretinoin is used for scarring acne. It stops the process in its tracks. And that's important because scarring is forever. Once you get those acne scars, it is very difficult to fix them. Now, there are treatments like laser and other sorts of cosmetic treatments, but nothing is a cure. Nothing is a sure thing. And so it's important to kind of get on top of it as soon as you realize that this acne process is occurring, because it is hard to reverse. In terms of costs, most of the time, isotretinoin therapy is covered by insurance, but you may want to check in with your coverage, your insurance, prior to starting. So what are the risks of isotretinoin? What is the con of taking this medication if it's so great? So the risk is that isotretinoin has a lot of side effects. So the main side effect is that it's teratogenic. That means that it can cause birth defects if you're on this medication and you get pregnant. That is why you need to be on 2 forms of birth control, and you need to get regular pregnancy tests when you are on this medication. In the US, this process is regulated through the iPledge program, which you will enroll in when you're starting isotretinoin. The primary side effects are also the treatment. So basically you're drying out the skin. Essentially, you're stopping those sebocytes from producing so much oil to cause acne. So you're going to feel dry all over. You're going to have dry skin, dry lips, dry mouth, sometimes an increased thirst because your mouth's so dry. Inside the nose gets dry, so you may have some nosebleeds because it's so dry. And you can have dry eyes and even eye pain from having these dry eyes. Things that help to reduce these discomforts include petroleum jelly anywhere you can apply it, mouth, skin, using lubricating eye drops, and using a humidifier for the dry nose and dry mucous membranes. So the other side effects include joint pains, sun sensitivity. You can have liver abnormalities or changes in the fat profile in your blood called triglycerides. You can have headache. You can have appetite changes. You can have hearing changes. You can have fatigue. You can have flare of infections, particularly herpes. You may have abdominal pain or other GI complaints. There was some concern that there was a correlation between isotretinoin and IBD or Crohn's disease, and that has not panned out in the literature, but something to bring up to your doctor. There's also some concern about psychiatric side effects, depression and anxiety. For the most part, the meta-analyses have actually shown that patients who take isotretinoin who have acne actually have their depression improve on the Accutane. And so the data have not supported worsening of suicidal ideations or depression. So certainly something to talk to your doctor about, including your therapist or psychiatrist if applicable. Sometimes you get a flare of your acne even 3 to 4 months into the treatment, so be aware of that so you don't get discouraged. So the good thing is these side effects mostly resolve once you've stopped the medication or decreased the dosage. So let's talk about the dosing and the actual process of being on isotretinoin. Let's just say isotretinoin, Accutane is a commitment. It involves regular appointments. You have to be able to go get pregnancy tests, get labs. The dosing is 0.5 to 1 milligram per kilogram per day, and you take it up to a max dose, which is 130 to 150 milligrams per kilogram. So the length of time that you're taking isotretinoin can depend on how slowly you escalate the dose, on any side effects you have, and your total dose and weight. Generally, it's about 5 to 6 months for a course, but it can run longer because we like to treat until the acne clears and then maybe a month further. General lab monitoring includes checking a fasting lipids as well as checking your liver enzymes. And usually that's done within the first month of starting isotretinoin, and then usually 2 months in or at the max dosage, again, just to follow those lab values. For women, pregnancy tests need to be done prior to starting the medication and prior to every single refill monthly.